guys, and welcome back to the Nurse Nook. In this video, I'm going to be explaining the differences between adult nursing and pediatric nursing. This video is sponsored by Halo White, which is a at-home whitening treatment that has made my teeth literally glow to the stars. Can we get like a close-up? Can I zoom in on these? Like, no, that's not working. Let me just, wow. So white. So this is a kit I have been using. That has just fallen all over the floor. So the best thing about this awesome kit is that it literally keeps the solution separate until it reaches your teeth. That is when it mixes together, which gives you like the most potent, best formula ever. Oh my god, what is wrong with me today? I'm dropping everything. My favorite part about this treatment is that it literally, you only have to leave it on for 15 minutes and there is no LED light required. It just does its thing and like, look. Hi, good morning. The solution is 12% hydrogen peroxide and potassium nitrate, and it is working wonders for me. You only need 4 to 6 treatments at home to achieve this bomb.com smile. You guys can use the code NNSMILE for 70% off this awesome kit. Again, 70% off this awesome kit. The link is down below if you guys want to check this out. And now let's get right into the video. So the first thing I'm going to start off with is kids are not small adults. They are completely different animals, let me tell you. Everything happens to them differently. They have different diseases that affect them. Their comorbidities are different. Kids are not small adults. You cannot treat them the same. You need a whole nother set of knowledge to take care of pediatric patients. So with that being said, because comorbidities are different and diagnoses are different, the medicines that we give them are totally different. So in the adult ER that I was working in, I was very used to giving a lot of medication that had to do with heart rates, that had to do with high blood pressures, a lot of code meds, a lot of medications that did not apply to pediatric patients. So when I came to pediatrics, things were a lot different and I was in for a huge wake-up call because everything was different. I knew nothing and I had to start my knowledge all over again. For one, the dosing is completely different with pediatric patients. Literally, adults get this much and pediatric patients get this much. And another thing with the dosing that you have to be very careful with is pediatric patients are dosed off of weight. In adults, it's not like that. There's just like a general dose that you just give for the entire spectrum for the most part. So that is something to get used to. I'm not going to say it's difficult to calculate medications because honestly it is not, and I almost enjoy it sometimes because I feel like it gives my brain a good workout to calculate medications, but a lot of times it's calculated for you, but you do have to double check the work and make sure that everything is correct and that you're giving the correct dose for the correct size patient. So with that being said, because everything is weight-based, you have to make sure every single patient is weighed accurately. So all of our pediatric patients, even in the ER, all of our patients got weighed, but in pediatrics, you want to make sure that you have a 100% accurate weight on all of your patients. As far as medications go, kids metabolize medications very differently. So pediatric patients metabolize medications very, very quick. Especially the smaller kids, like our toddlers metabolize meds very quick. And I'll give you guys an example. We use ketamine frequently in the pediatric ER when we're doing moderate sedations for a suture repair or a fractured bone. We use ketamine pretty frequently. Ketamine is a medication used to moderately sedate patients, and the pediatric patients, especially like the toddlers that we give this to, metabolize it very quickly. So for an adult, we might use whatever the ratio is to their rates. I'm not going to get into specific calculations now because that is not my specialty, but adults metabolize it a lot slower. So where kids most likely would need more doses per their weight to stay sedated throughout the procedure. So we will a lot of times give one dose, and then we notice the patient is waking up or moving around and starting to feel maybe a little bit of pain, and we will give an additional dose. Because kids metabolize it quickly, so it goes through their system a lot quicker than it would with adults. Another difference in pediatric nursing is Age plays a huge part, because you can have a 3-week-old in one room and have an 18-year-old in the next room, and both of these patients have extremely different systems, different diseases that will affect them, completely different immune systems, and you would treat them completely different. So it is important that you know how to treat them differently, and you know about each age group. That is a big thing with pediatric nursing, is you need to know the developmental stages and what is important to look for in each developmental stage. Especially in newborn patients, there's a whole different variety of knowledge to have, especially with reflexes and how many ounces they should be eating, by what age, and all of that information in one. Another big thing with pediatric populations is how long it takes to do things with them. In adults, I could pop an IV in a minute and be out. With pediatric patients, you literally need to recruit an entire team to come in there and help you start an IV. You need a holder, you need probably another holder depending on how old the patient is and how strong they are. You need to papoose them, roll them up, and it's gonna take a little bit longer than it would for an adult IV. No matter what you're doing with medications, it takes longer. With wrapping an ankle or whatever it is, it takes longer. Cathing takes longer. Everything with kids take longer, because a lot of times they don't understand what you're doing, and they don't understand why you have to do it, and they don't want it to be done. So the last difference that I'm going to talk about between adult nursing, pediatric nursing, which is a huge reason that a lot of people kind of shy away from pediatrics, is the parents. Sometimes the parents can be a little bit overbearing, and that is understandable. This is their kid that you're caring for, and a lot of these parents can be first-time parents, and they are very involved in the care, and sometimes a little bit too involved, where it kind of hinders you from doing your job properly. You know, they want to be all in the mix and let me see what's going on, I want to see, which is completely understandable, but sometimes it can get in the way a little bit of nursing, and you have to set boundaries. And sometimes parents don't like when you're doing certain things, especially when we're starting IVs. A lot of times I see parents cry, family members cry, and sometimes you have to, depending on what you're doing, you have to ask them to leave the room or whatever it is. It takes a long time with pediatrics. Things are not simple. There's a lot of hoops that you have to jump through, and there's a lot of different obstacles to getting the job done. So patience is a virtue in pediatrics. Patience is probably the best thing for you to possess to be a great pediatric nurse, and that is probably the best advice that I could give you. So those are just a few of the differences between adult nursing from pediatric nursing. From my opinion, from my experience, there is like a huge list that I can go on forever, but those are just some of the most important things that stick out to me. I hope you learned something from this video. Let me know down below what you think, and what do you think your differences are from the adult world and pediatrics world. If you do have experience, let me know down below. I'll see you guys in the next video. Thank you for watching.